Welcome to the Listen Up podcast, where we explore hearing loss, communication, connections, and health.
Hey everybody, Dr. Mark Sims here. I'm the host of the Listen Up podcast, where I feature top leaders in healthcare. This episode is brought to you by Listen Up Hearing Centers. I help patients to effectively treat their hearing loss so they can remain independent and better connect with loved ones and family. The reason I'm so passionate about hearing loss is I lost my brother Robbie twice. First to his hearing loss from radiation to his brain tumor, and then again when he passed away. I'm a otologist. I only care for ears. I'm the E of ENT. I've taken care of tens of thousands of patients with hearing loss and done over 10,000 surgeries over the past 20 years. I'm also the founder of Listen Up Hearing Center and written a book by the same name, Listen Up, A Physician's Guide to Effectively Treating Your Hearing Loss. If you want to learn more about that, go to listenuphearing.com. That's listenuphearing.com. Today, I have a great guest. We're excited. It's Dr. Laura Bradley Pratesi. She is an awesome audiologist who was born with a progressive hearing loss and is currently a bilateral hearing aid user. She also graduated from Auburn University with her Bachelor's of Science in Communication Sciences and Disorders in 2008. And then she went on to do her doctorate at the same university and graduated as the youngest person to complete a Doctor of Audiology at Auburn in 2012. Since that time, she's been named in Orlando Magazine Woman of the Year in 2020, had publications featured in the Hearing Journal, and been a presenter for Audiology Online. She also has been busy. She founded her Citrus Hearing Clinic in 2018. Her goal is to better serve her community with best practices audiology services for all ages. We're excited to learn more about her and to speak to her. She is both a master audiologist from both a patient and a practitioner's perspective, which is a great perspective for us to learn about. Thank you so much for coming on today.
Thank you so much for inviting me.
So Laura, obviously, as the intro indicated, you have hearing loss. I assume that was kind of what led you into audiology, or other things, or both?
No, yeah, it definitely was. So I was diagnosed with my hearing loss when I was 5 years old, but I kind of fell through the cracks and wasn't actually fit with my first hearing aid till I was at Auburn. And I was fit by some of my classmates. I was originally a musical theater and opera major, and I was interested in the idea of doing music therapy because I didn't want to be a professional waitress. Not that there's anything wrong with that. I did it as an actress, and I thought music therapy would be for me. And Auburn didn't have a music therapy program, so I started taking rehab and special ed courses and speech pathology classes, and I ended up in the Intro to Audiology course and got 100 in the class, and the professor was like, "You need to do this." And I found it fascinating. It was the first time I really understood kind of what was going on in my own life. Reading about kids with hearing loss, it was like looking at my diary from childhood. And so I said, I need to go into this. And my classmates fit me with my first hearing aid, and it totally changed my life. And I said, I need to do this so that I can help make sure that nobody else falls through the cracks like I did.
Wow, that's a wonderful story. So, when you say that, I mean, I understand. So you were diagnosed at 5, didn't get hearing aids till early adult life. So tell me, frankly, I think falling through the cracks is probably a nice euphemism for what you experienced. And so can we tell me a little bit more about, like, what were those things as you fell through the cracks, right? And probably they're pretty big cracks, unfortunately.
Sure. I mean, I was born in the late 80s, so that was kind of before the universal newborn hearing screening was around. And I know that my mom had concerns. She had her master's in early childhood education, but the pediatrician just was a great pediatrician, but kind of blew my mom off, was like, no, she hears fine. Oh, look, she turned her head. You're good. So they were having screenings in preschool before I got into kindergarten, and my mom signed me up for that, and I failed. And then that finally got me a referral to kind of a local ENT practice in town. And they tested me and found that I had, at the time, this unilateral hearing loss. And I know they did a CAT scan. I was just 5, so I don't remember a ton of stuff, but but I know that they told my parents, and of course, hearing aid technology was very different in the early 90s from what we have today. But they kind of told my parents that, oh, it'll just amplify things, it'll make stuff loud, it'll distract her in class. So as long as she's making A's and B's, don't worry about it. And from the time I was 5 until I was about 8, I think they checked me every year. And then when I was 8, they were like, oh, it's staying pretty steady. You don't need to come back unless you notice a change. And so when I got into Auburn, I decided to apply for the Office of Accessibility. Back then it was called the Students with Disabilities Department. But I wanted to make sure I had accommodations if I needed any. And I was a little concerned that, I'd be in a class with 300 people in the lecture hall and it would be a struggle. And so I went to them and they were like, we're going to need some test results that have been done in the last decade. So I found my way back and got an updated test and it was pretty consistent. And they were shocked that I had gone so long without amplification. And so they said, do you want a hearing aid? And I was like, well, do I need one? And they said, probably not. You've been getting by. You're probably fine. So I was like, oh, okay. I mean, I didn't get an opportunity to listen to one. I didn't know what I was missing. Didn't know how different it could be. So yeah, it wasn't until it ended up being sort of, I think the first day of grad school, we had a rep from one of the hearing aid manufacturers in there. And they were like, well, we're going to teach you about hearing aids, but if only we had a patient we could fit. And I was like, I volunteer as tribute. So they threw me in the booth and tested me and fit me with my first hearing aid. And sound quality difference for me, it was like I'd been underwater my whole life. It was that dull, muffled, distorted kind of sound. And then all of a sudden, everything was very sharp. It was very clear. It was harsh and tinny, but I loved it. And I just remember getting in my car and having been a theater major, I think it was Defying Gravity or something from Wicked. And, I get in my car and first thing, gotta turn that volume way down. And then just how rich and full the music sounded. And I cried all the way home. And then I got home and I thought, is something wrong with the refrigerator? Why does it sound like this? And my sister's like, that's normal. So it took a while, but I really should thank my professors because as I was going through that process, they made me keep kind of a journal about my experience and everything. And so I had to share with the class and I kept all those notes so while it was unfortunate that I went so long without help, because I was an adult going through it and because I was an audiology student at the time, it's still very fresh in my mind. And
Sure.
Now when I go to fit my own patients, I kind of can anticipate what they're going to experience and how it's going to play out. And I can forewarn them, oh, by the way, this is what you need to know because I didn't realize that the public restrooms were going to sound like Niagara Falls until I went into one. So
The world's a very noisy place.
yeah. Yeah. So I think my experiences have made me a better audiologist.
I agree 100%. So let me ask you a question. One of the things that's interesting about your story, when you went to college, you had an inkling that something was not, because you went to look for accommodation, right? And so can you take us back? Like, what were the things or was it because you were stepping up to college from high school? Or was it that you were aware that there were things you weren't getting?
No, I knew there were things that I was missing. I would sometimes miss instructions in class. I think I would copy down like the wrong homework pages to do sometimes, or announcements over the intercom in the classroom. I never could understand, it's so garbled. I couldn't understand that ever.
They might be garbled anyway, to be honest.
Yeah, you're right, exactly. And then, of course, taking a foreign language was mandatory. So trying to do the listen and repeat in Spanish when that's not your first language and you can't hear all the sounds. And so I knew that I struggled, but I just didn't know that a hearing aid could help. I didn't know that it could be better. No one had ever talked to me or counseled me or advised me about technology that was out there that could assist. And And we used captioning on the television at home from the time I was very little. And I did struggle to learn how to read. I think it was end of second, beginning of third grade before that really caught on. And then I became a voracious reader. But they taught reading by phonetics back then. So it was all how it sounds. And I never did great on spelling tests, but always did well enough in school, A's and B's. But I was, again, lucky. My mom was a teacher and I loved school. So, it was the idea of the 300 kids in a lecture hall that was intimidating to me, that I thought, well, maybe I can have a note taker, or maybe there can be some cart captioning or something that can assist. And I was glad that I did that.
No, that's great. Self-advocacy is not common, especially if you're newly diagnosed.
Yeah.
Right. I mean, it takes time, a little bit. And so that's great. So you've kind of brought all of this experience with you to your own practice, right?
Yeah, I, now I do work with the Lake County school system. So all the deaf and hard of hearing kids in the school, when they're up for their annual reevals and things, they usually come through my clinic. And so I feel like it's kind of come full circle, because now I'm advocating for them and teaching them. And pretty much any pediatric patient I see, I try to convince to go into this field, because I'm like, we know so much about it. And I'm like, yay, deaf and hard of hearing audiologists. I think we make the profession better. But yeah.
Yeah. You have any wins?
What's that?
Do you have any wins yet?
Wins. Yeah, I have a high school student right now who's interning for volunteer hours for school, but she's thinking about it for later on, and that's
a win in and of itself. That's a win in and of itself, right? So even if she doesn't go all the way through the program, that's really wonderful. And so, how do you think, when you communicate with adults, how does this affect your? I mean, I think you obviously have a better understanding of it, but like in specifics, what type of things do you share with your adult patients?
I'm very open about my diagnosis and my hearing loss. And I think that one of the things I have seen with my own practice is that I have tended to attract a lot of young adults with hearing loss. And I think that they're excited to see somebody who looks like them. A lot of our marketing tends to target seniors, and, you've got all the gray hair and all the marketing pictures and materials and things. And I'm like, no, if you're born with ears, you could have hearing loss at any age. And I do get a kick out of it whenever I have a patient that starts telling me how they, that they don't want to get hearing aids because they're only in their 50s or 60s and they don't want to look old. And I'm like, oh, does mine make me look old? And then they're like, no, you don't have them. I was like, yes. So that's always a fun reveal. But I also tell them that, mild is a misnomer. A mild hearing loss is still a big deal if it means that you're not getting 100% access to sound. And, if
even low normal.
Yeah, exactly. Right. And, if people would do anything for their children, right? They would move mountains for their kids, but they won't necessarily do something that's going to help themselves. And so I kind of put it to them that way. I'm like, you're just as important as your kids. Like, if this was your child that had this degree of hearing loss, you would get them intervention. So why are you not going to take that step for yourself? You're important too. It's the whole, when you're on an airplane, you got to put on your own face mask airbag before you help the person next to you. And so, and I think that there's just been so much wonderful research lately about the brain and how this affects the brain, and mental load and auditory fatigue. And I pull that in, and being able to fall back on, I used to get really tired and cranky at the end of the day when I didn't have my hearing aids, and they see that reflected, and I think it helps with acceptance.
Sure. And so with that younger population, do you spend maybe a decent amount of time on hearing conservation as well?
Oh, absolutely. And we do a lot of work with veterans as well. We do some contract work with the VA, and We had a 4th of July event in 2019. It got canceled in 2020 and the schedule's been a little off, but the local fireworks display, Red, White, and Boom, it's a big deal. Everybody goes to it here. And so my team and I, we went and we set up a booth and we handed out over 300 pairs of free earplugs that day. And it was funny how many people would pass us by and be like, I don't need that. And then as soon as the fireworks started, they were rushing
back
through.
to get them,
like couldn't give them out fast enough, So I always tell people, I would rather you use these and not have to need me later, but you can either take the earplugs or you can take my card because you're going to need to use one or the other.
Fair enough. That's great. That's great. And so how about like long-term in terms of those patients in the relationship? I'm sure there's some patients you have long-term relationships. You guys share the journey together or how does that,
Yeah. And that's been one of the really great benefits with starting my own practice is getting to follow people on that journey and getting to see them grow and their self-confidence, to grow, but and working in the same town where I live, because for a while I was, living here in Claremont, but I was commuting, an hour away to the practice that I was working at. And but there's something about running into your patients in your own community and investing in the community that you live in that has been really rewarding for me. And I worked for an ENT practice when I lived in Georgia, and the ENT, he had been in practice for 30 years. And so one of the things I loved about working there was I would fit the grandparents with hearing aids. Their adult children had been, the kids getting tubes when he had opened the practice. And now we're seeing the grandchildren for their first set. Yeah. And so having the 3 generations in my office at a time as I was taking care of things. And we're starting to see that now here that we've been a little bit more established. We have a little over 2,000 patients in the system, which for being open 4 years, I think, especially with 2 kind of pandemic years, I think is a pretty big deal.
Yeah, wonderful. Great for you. That's awesome. I mean, treating a lot of hearing loss is a wonderful thing. And so how about from a technical audiologic point of view? Are there some insights you garner because of your hearing loss that maybe you could share with other audiologists about hearing amplification or things like that?
Oh, I mean, it's changed so much just since, I started Auburn's program in 2008 and like how far technology has come is crazy. My hearing aids can do so many more things now than they did when I first got them. But I do think that having hearing loss gives me a bit of an edge because pretty much when anything new comes out, I try to get a set for myself that I program that I wear around so that I can see, okay, well, does this forward focus really focus forward? And okay, does this the speech in 360 really do 360? And so testing out, the hearing aids, but also some of the FM accessories and the telecoil when I go to the local HLAA meetings, I think just using the tech myself gives me a better idea of how to troubleshoot it. And how to advise patients, your aids are turning up and down volume on their own. It's the latest iOS update. Mine's doing the same thing. So, and it also has helped when I've been like, these rechargeable Z-Power batteries are really not holding a charge. Let's not fit this on anybody else. So I think that using the tech has made a big deal and beyond hearing aids too, captioned phones, captioning apps, using the Captive View when I go to the movies. I may not be deaf with a capital D, but I benefit from having the captions. And if I'm the one person with hearing loss that makes the little theater manager like dust it off and make sure it's working, that will help the next person that comes through that needs it and requests it. Because sometimes you run into people not knowing how things work. And
sometimes,
and
I'm kidding. It's a lot.
So I'm like, no, accommodate me so that I can tell people you have this here and this is how it's supposed to work. So I try to I get excited when things come out because I like to test them myself. And if it's not something I would use, then I let people know that too. Or if it works really, really well, I'm like, okay, it's not perfect, but this can really help in this situation.
No, that's great. So it's really, you've test driven all the technology so you can kind of give a test drive report.
Yeah. And I precept students. I've had probably about 12 students from 5 or 6 different universities come through at this point. And it's been really fun, to show them that. I'm like, okay, this works well for me and this doesn't. And we follow best practices. We run electroacoustic analysis on all of the hearing aids that we're fitting. And it's been interesting, like, to run it in the test box and see the numbers and be like, oh, this one's directional microphones are a little bit better. Or, oh, this one seems to perform a little bit better with attack and release times. And then to then wear the technology and see, oh yeah, I can hear it adjusting, or okay, yeah, I struggle more in noise with this. And so we can kind of see technical wise, like how that plays out in different scenarios. And then if there's someone that is a musician or, works at Disney and and has is in crazy different kinds of listening situations, we can be more specific in our recommendations. And that's why I work with all the 7 major hearing aid manufacturers, as well as some of the little ones as well, because there's no one that is perfect at everything. And there are some of these niche products that are, the best at XYZ. So it's like, okay, if they need a custom, we're going with this. If they're a musician, we're going with this other thing. If they have tinnitus, this one tends to have the best tinnitus masker. And so it just helps us to make sure people are getting in what works. And I know that there's an idea that, oh, you can really only be an expert at 1 or 2 brands of hearing aids. No, if you understand how hearing aids work, you can fit anything. I might not know what they call their threshold knee points or where it is in the software, but tech support is only a phone call away. So, and once I ask once, I can find it again in the future.
Well, I also think actually having a broader spectrum, you can find the closer right fit as compared to
Yes.
what you might be sharing is actually the exact opposite sentiment where the manufacturers want you to only have 1 or 2.
Yeah, they want
I'm
that
not sure that's
brand
really true. I'm
loyalty.
not sure there's any data saying that you can only master 1 or 2, right?
No, right. It's just opinions.
Right.
But yeah, I think that exactly, you're not having to compromise on by having a limited scope of what product you can fit someone on. And then being in Florida, where we're kind of a unique place where we have snowbirds, and tourist patients, and so you never know what's going to walk in the door anyway. So you better be up on it. But,
No, yeah, I hear you. We same phenomenon, obviously, in Arizona. People from all over,
yeah.
the Midwest or upper parts of the United States.
And I think that's, we're more of a trans global society than we ever used to be. So that's probably the case a lot of places for sure.
Agree, agree. That's great. And so, what would be some of the long-term insights you'd say of being in private practice that you'd share?
Oh, I mean, I haven't been doing it for that long, but I really I like the flexibility. It's been a big quality of life improvement for me, and it's been helpful to run it the way I think it needs to be done, because some of the things we're doing here, I think, are a little outside of the box kind of thinking.
Like what?
Either in like our approach to kind of grassroots movements, like with trying to get the hearing protection out there to places, or with working with so many different hearing aid manufacturers, but then also trying to practice to our whole scope. We in addition to hearing aids, we're also doing cochlear implants and osseo integrated devices. And I just bought B&G equipment that I need to get up to date and up on my wall. So I really think that if I mean, it's not easy to offer it all, but did we become doctors because we thought it would be simple?
Right.
I think that in order to take care of the patient as a whole person, you have to be able to take care of these different aspects. And it's possible, just like you can do tubes and a tympanoplasty and, acoustic neuroma
Right, the full
removal.
spectrum. Yeah.
Yeah, full spectrum. So I want us to be looking at full picture and not just, okay, we mapped your implant and that's it, but okay, we mapped your implant and now let's do some oral rehab. Or okay, you came in with complaints of hearing loss, maybe your audiogram looks normal, but Now let's maybe dig into either hidden hearing loss or auditory processing issues. Like if the patient is here in front of you, they're here for a reason. Like they don't just fall in your lap in private practice. They had to seek you out. It's not just they got sent down the hall. So, all right, I'm here, I guess. They're coming to you for something. So figure out what that something is and help them with that.
Yeah, I mean, I love your passion about it and practicing the whole spectrum. It's wonderful. So,
Yeah.
so tell me, what's your favorite sound?
Okay, I have this video where my husband's stepfather was pretending to sneeze, and my little boy was just like, I don't know, 9, 12 months old at the time. And his giggle in this video is just the most hilarious thing. It is so funny. I could listen to it all day. He got like breathless laughing just over and over again. And I caught it on video, and I'm so glad. And I have it on it was one of the first posts for the business for an Instagram post was, here's my favorite sound.
Oh, that's wonderful. Wow. So you've already answered it on social media. Good for you.
Yeah.
You're way ahead of me there. So, and Laura, if people want to get a hold of you, how would they do that?
Sure. So we have online scheduling on our website because we know it's not easy to use a phone for everyone. So if they go to www.citrushearing.com, contact us through there. We're also on Facebook, Instagram, Twitter. Our landline is 352-989-5123. And then my email is drlaura@citrushearing.com.
Yeah, this is Dr. Laura Bradley Pratesi. She's the founder of Citrus Hearing, and she's clearly a passionate and awesome audiologist who just loves this. I mean, what an easy conversation, because I can tell you just love what you do, which is really wonderful.
I do. I think that some people are called to the ministry. Some people, this is my calling. I was called to be an audiologist. This is what I was meant to do. And I could talk about it all day.
That's wonderful. I mean, you ooze that enthusiasm, and I'm passionate about hearing loss as well. And I love finding other passionate people who really care about this subject and this topic. So this has been a great episode. I really appreciate you sharing your personal stories and your perspective on hearing loss. Thank you so much for coming on.
Yeah, thank you so much for having me. It was a great pleasure to be here.
This is fun. Thanks again.
Thank you.
Thanks for tuning in to the Listen Up podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.